So let's talk about a bit about what today is all about. We're going to talk about the responsibilities that you have to to the public and to your patients regarding a breach of secure, protected health information. Remember, if you're a covered entity, which is a health plan or a healthcare provider or healthcare clearinghouse, or if you're a business associate providing services for a covered entity that uses PHI, you have certain obligations under HIPAA. And the obligation we're talking about today is what happens when you find that all of a sudden there's been a breach of the security of this data. And as we'll see, it's a breach not only of the electronic data, but also of the paper data you might have laying around. So let's go ahead and look at the definition of what a breach is. And if you take a look at this slide, I hope it gives you a headache, because it certainly gives me a headache. Some lawyer somewhere got paid a lot of money to put these words on this piece of paper, and we're going to have to kind of cut through and see exactly what they're talking about. So if you're covered by HIPAA, a business associate or a doctor's office, and you find that there's been an unauthorized acquisition, access, use, or disclosure of PHI, so what does that mean, unauthorized acquisition, access, use, or disclosure? That means that there are all types of people who are authorized to take a look at protected health information. It might be your nurses, or when you pick up the phone and schedule an x-ray. All of that is authorized. But what happens if someone acquires or accesses or use? And what does access mean? Access means basically you've been hacked. If you're using electronic data, medical records, and someone unauthorized has access to the data, well, that's a breach. And you stop and think about it, well, that's weird. How do I even know if someone's accessed it? And not only that, how do I know if they've accessed it, if they've actually taken it, and if they've used it? Unless it shows up on some form that says, here's some Social Security numbers I got from the doctor's office. So, we have to stop and look at these words and say, what's going on here? Well, we know that if there's been some unauthorized hack to your electronic medical record system, and whether or not does that compromise the security or privacy of the information? Well, absolutely, because under HIPAA you have an obligation to make sure you have secured the privacy of that data. Then that is a breach. Now, there are some exceptions. There are 3 exceptions in the statute and the regulation. And here's one that just kind of sits out right on the statute itself. Except where an unauthorized person to whom such information is disclosed would not reasonably have been able to retain such information. So, what does that mean? That means that a person would not, arguably, that if I've accessed it and I'm unauthorized and I got my hands on it, but it turns out it's encrypted or it's gibberish, does that mean that there's been a breach that I have to act on? And technically the answer is no. I mean, if you've had some type of access of protected health information, but it's in a manner that would not reasonably been able to retain it, well, then there's been no breach, which is actually really, really nice. And it's interesting to think about that in this context. And the regulation gives us 3 kind of exceptions to the definition of breach. And it's typically all of them go along these lines. There's been some minor discrepancy. I have a good faith belief that the unauthorized person who got the disclosure would not know what to do with the information, or we're going to presume that a business associate kind of let some information out, and we're going to say, well, it's not a breach if the data got out of our control, if we can prove that nobody was really kind of hurt by it. And the rules give us some 4 types of things to click off to make sure whether or not somebody's going to be hurt. We have to, every time we think there's been a breach, we have to make an assessment that the extent and type of the information involved, whether or not it was how the information was disclosed, whether it was actually viewed. Let's say maybe it got out of the box, but nobody actually saw it. A laptop was stolen. Can we prove that the laptop was never, ever, ever opened? Well, if we can prove that, then maybe we can go back and prove we don't have a breach. But what all of this does, these rules that came out in 2013, what they do for us means that if there was a breach, if we have noticed that someone's hacked us, if we have noticed that a laptop's been stolen or missing, then we have to presume that there was a breach. We have to presume that someone opened it up, looked at it, and used it. And the only way we're going to escape our obligations to report the breach and take other action is if we can positively, objectively prove that the laptop blew up before anybody saw it. Now, if we can't do that, then we're trapped into these rules of going through the breach notification. So let's take a look at the next slide. Then we have an understanding what a breach is. We had an obligation to make it secure. Somehow the genie got out of the box. We can't prove that the genie blew up before he or she said anything. We've got a breach on our hands, and we have to act. Typically, only the patient can decide when to release their protected health information. So we're talking about, how do we do access? Access to data.